Hello, ladies. How are you? Welcome to Her Opinion Show. I have with me Dana Omari-Harrell, right?
Yes. Thank you for having me.
Of course. So, listen, wait. Before I get started, the last podcast I said listen like 30 times. I'm not trying to do that today. But I saw you on IG and I've seen your videos and I've listened, and I learned a couple of things. Yeah. So, Jen, have you seen some of her clips?
Yeah, and you know what? I think it's really great that you're here because I think I need a little bit of help. I know she gets a lot of facials. I don't take care of my skin as much as I should.
Actually, I don't either. Facials here and there. I feel like the facials are more therapy for me.
Right.
I don't like sitting still and being, I don't know what it is.
Yeah. It just takes forever. I'm just like, hurry up. If you're going to do it, just hurry up.
But I am curious about laser. But let's say what she does. First of all, you talk about beauty. Right? And a little bit more towards plastic surgery, right? Yes, which we all want to know about.
Right.
Yes.
Because no one talks about it.
No one talks about it. We want to know the nitty-gritty, the behind the scenes.
Which part?
The
surgeon master?
All of it. I want to talk BBLs. I want to talk the dirty truth. But how did you get started? Give us a little breakdown because we know you're doing very well right now on IG, Instagram. But I just want to know, what did you do before that?
So I'm a registered dietitian with a master's in biochem, and I was doing, I was over the whole wellness department of this med spa that had a plastic surgery clinic, like not necessarily attached. Just the doctors. There's one was a plastic surgeon, one was over the med spa, and you get trained on everything, like all the lasers, all the procedures, so that you can talk to patients about it. And I was just really good at talking to patients about procedures they've never heard of, breaking down plastic surgery, like what are their options, what can they expect. And the doctors I worked for took note. And then we did like a company-wide training on that. Like, how do we talk to patients about this? Because they have all the knowledge, but then sometimes sitting in front of a patient and the patient doesn't even know the difference between Botox and filler. Mm-hmm. And here's the surgeon talking about, these are the two different sutures we can use. And the patient is overwhelmed. It's scary. And they have no idea. They usually then like go home. And they're like, that was intense. I don't know if I can do that. And then, it's a small industry. The doctors I worked for talked to other doctors. And then suddenly I was getting, hired as a consultant to teach them to have effective consultations. But in the consultation process, I met so many patients, and I realized how few knew anything about procedures. Mm-hmm. And it's partially because we don't talk about it, it's taboo, and partially because there's so much misinformation, specifically with celebrities lying. Like just straight up, no, I didn't get a facelift. I just go to this facialist, and that's not what happened.
Yeah,
and a lot of them get paid just to promote something.
Yeah, and then we go to the facialist and we don't look like that celebrity.
Exactly.
Right.
Why didn't I look like that?
And they got it for free. It's like, how are you a multimillionaire and you get stuff for free? And I'm just like, I'm a working girl.
Exactly. But, so we were talking about different facials, different lasers, all these different things. So how do you keep up? Because I feel like every year something new comes out, doesn't it?
Really, it's just like the technology. So it sounds like something new comes out, but usually it's either a different brand of something or they just change something just a little, like it's a little bit more effective with this. But it's kind of like thinking about it, I don't know, maybe think about it like food groups. It's like there's not a brand new cheese, right? Mm-hmm. It's just a little bit different than all the cheeses that are out there. But that's different than like fruit. So there's like classes of procedures and things, and then we just enhance them a little bit. Like, okay, we got a little bit better with this technology in IPL science. We got a little bit better with a different type of maybe thread for sutures for surgery, So there's improvements, but it's not completely different. Why you guys think it's different is because of marketing. Right. They're marketing buzzwords. Sometimes they remarket old things as if it's brand new, newly discovered. Ozempic, like everyone thinks it's a brand new drug. It's like 20 years old, or that class of medications, 20 years old, but it feels new
because it becomes popular.
Because it's popular,
Makes
to
sense.
people who don't know much about it. It's brand new.
So if you were gonna say, if I was like a client coming in and I wanted to know about laser,
Right.
and I wanted to,
Wait, laser what part of the body?
face. Face, of course. I mean, that's another story with hair removal and things like that. But if I wanted to get something done on my face, and let's say your office holds, one of the plastic surgeon or the med spa holds 6 different lasers.
Right.
How do you break down to somebody which is the best laser for them? Because technically, in a way, it sounds like they all do kind of the same things. Maybe 2 or 3 of them don't, but...
So really what the consultation is, I always started with, okay, what is your concerns? Like, why are you here? What brought you in today? What bothers you? What do you love that you would enhance? And then let's talk about that. So if it's like, oh, I just have these discolorations, or my face is doing this and they're pulling down and I want it to do this, then I'm like, okay, let's talk options. There's this, that, and this. These things do these, whatever it is. Does that make sense? Break it down. And a lot of times, like with aesthetics, it's not one thing. So maybe we do a whole treatment plan. Okay, these things are what bothers this person, and these are the things that they love about their face. So let's do a filler here, Botox there, the lasers starting with microneedling first and then lasers later. And then we're probably going to start looking at maybe a lower facelift for the like jowling and something like that. Does that make sense?
Yeah.
And it's a whole treatment plan. You don't have to buy into all of it, but this is the end result you want, and this is how you get there.
So does all of it, like if you say like a facelift or what you were saying, does it all have to go, like you have to go under?
No, not everything you have to go under, but like a facelift, yes.
Yeah.
I mean,
Like
I've
a
heard.
good facelift.
Yeah.
like
Nowadays,
real
they're
one.
just doing a little numbing. And
Yeah.
I've seen some of these, it's a quick facelift and you're in, you're out.
Yeah, I mean, it depends. Like if you're doing like an endoscopic brow lift, which is like tiny cuts right up here and pull, you don't need to go under. But like if you're doing a deep plane facelift, I would never want to do that awake.
Of
and also
course.
it's
Yeah.
hours.
No.
Hours.
No.
No, thank you.
Yeah, and you're
Don't- and
watching
don't-
everything
Yeah.
going on.
No.
You're like, what are you doing now, doctor?
You should definitely recheck the doctor if they don't
Right.
want to put you under, right?
Right.
For something like
I
that.
saw someone on your page. Sorry, I was snooping around. They did for the chin.
Yeah, that was my sister.
And that
She did
was-
chin lipo.
was it?
Awake. Yeah.
Yeah, awake. I thought that was kind of like scary. It looked like it bubbled up a little
well,
bit.
a lot of the lipo, I think, is numbing right now. You can do that with
Yeah,
just the
But she
numbing.
looked like it didn't hurt at all.
It,
like
it
was
didn't. All she
just-
felt was pressure.
Yeah.
So with lipo, that what the bubbling up was the fluid that we
Yeah.
injected, because you inject fluid first of all for numbing, and second of all to ease like the removal of fat cells,
Yeah.
because you're essentially ripping fat
Yeah.
cells out of your body, and it's attached. It's not like they're free floating in there,
Yeah.
you know. So we put liquid to like ease the suction.
Yeah.
Well, this is the thing that
It looked really cool because
Yeah.
she looked really,
Immediately,
It-
right? Oh my
immediately.
God, she's so happy.
yeah.
Shout
Who
out to
wouldn't
Dr.
be?
Ashley
I know, right?
Steinberg. Like now I want to go and be like, Ashley, do you mind?
I know.
Oh.
I'm like, do I have one?
Just
well,
do it anyway.
when is it like you can't get it? Because sometimes it's skin and it's not fat.
Yes.
So if you don't have enough, is that something different?
Yeah, it would be a neck lift.
A neck.
Yeah, so when it comes to skin, if you have like excess skin or it's drooping, truly the only thing you can do is cut it. So that's whether it's a tummy tuck, like if you have extra skin on your belly, there's no amount of lipo that's going to get that. You're going to have to cut that skin and, sew it up. So same here. Anywhere on your body, if there's more skin or it's drooping, it's a lift.
And I think that's the problem that we see is that if I come into you and you tell me, listen, you don't have enough fat here, you're probably going to have to do this or that. That's when you see a lot of things in pictures that you don't understand, which is like, okay, so let's say I had to cut here, but then I have to put filler here to give me the contour now. Some people have a chin implant, right? There's so much more, but then they say, oh, I only had filler. You know what I
Right,
mean?
exactly.
Or I only had, and you're like, that can't be. There's just no way, and then thinking about how much filler it takes to contour that jaw.
Right.
It's like thinking about them paying that over and over again a month.
Well, there's implants, and that's very popular, especially with celebrities. Like people go, there's no way that they got a chin implant, cheek implants, things like that. Surely they're getting filler. No, a lot of them aren't. The ones that do, you can tell if they've been getting a lot of filler for a long time, like the puffiness and stuff, because they need to look consistent day to day. Like for us, like if you mess up your lips a little and they went a little too big, you know, we can dissolve or just wait it out. But like for them, like imagine an actress in a TV show. And when we do notice, like, what's the girl? Her name's Erin something. She was on The Boys. I did see a little bit of that beginning. So her look has changed consistently. Like she looked one way season 1, another way season 2, another way season 3. And so then people were asking her, like, what are you doing? Like, what are you getting done? And she was like, oh my God, guys, you're bullying me. It was insane. But she wasn't consistent looking. And I'm not saying that it's like, oh, they never get work done. It's that her lips were a little bigger once and then a little smaller another time and then back to bigger. Yeah. And it's almost like whiplash because for her, it's been months. But for us, we're seeing her like all in a short period of time on the show. Does that make sense?
Yes.
And it's kind of scary because sometimes whenever you talk about fillers, people think, what are you injecting inside of me?
Right.
And it's kind of scary. I mean, I know that sometimes they say, oh, if you get this, it'll look a little bit thinner here and there, and it's fillers. And I'm like, I don't know.
Yeah.
Fillers are hyaluronic acid. Our bodies produce hyaluronic acid. That's what makes your lips plump, your skin plump. So it's just... It's
something that's going to dissolve in there.
Well, but then they say it dissolves, but then a lot of times a lot of people have an issue where it's not dissolving. So how does that work? Because you hear people saying they're having to get it squeezed out.
Yeah.
Okay, squeezed out is crazy. Like I'm like that's they're putting the wrong type of filler, too much of it all at once. Like that's a whole other thing. That's not normal.
That's a different show.
Well,
we're gonna get there.
Yeah. That is. Don't go to your like back alley and check, make sure everything's good and legit. No. So your body, like I guess it gets hard because people don't really know much about like chemistry, like biochemistry and physiology,
and that's what you have
right?
A degree with.
So like your hyaluronic acid, for example, naturally occurring in your lips, it's not the same that you've had since you were a baby. All of our like body like has different cycles. So like cells, your body makes new cells and gets rid of old ones. Same with like hyaluronic acid. So in your lips, it's naturally occurring, but it's not the same that you've always had. Your body breaks it down, rebuilds it, breaks it down, rebuilds it. So the hyaluronic acid that you're injecting from injectables, it does the same thing. Your body will break it down. There's also like about a coded amount like in your DNA about how much you're going to have. So if you put in a ton, your body's going to be like, whoa, this is way more than usual. We need to get rid of this, right? That being said, if you do a lot frequently, like layer after layer, it can be where your body is like, okay, like now this is the new normal. So we're not going to break down as much. And then it also, we don't know exactly what happens to certain people. Like some people breaks down very easily. Some people, it stays in there for years. Everybody's different. Like chemistry is amazing like that. So.
Well, sometimes I feel like even though it's not from your body, right? And your body's not producing it, your body can still react to it and have a different reaction, which when you say some people break it down easier than others, maybe their body is actually fighting it and helping it, dissolve it from the system than others who may not be, their body's not as strong, their immunity's not as strong, and just takes it in.
It's not an immune system reaction. If it were, that's usually when they're having like an allergic reaction or an autoimmune. The breaking down, it's literally like, like in their code, I'm just gonna make up random numbers that don't. If anyone who's in science is listening to this, like if you have 100 units of hyaluronic acid, it like naturally occurring in your lips, and then you add 50, like your body is going to say, oh, but we're coded for 100. Like what's happening here? Why do we have too much? Why do we have excess?
Yeah.
And, try to break it down. It's not really an immune reaction. It's just like homeostasis, like trying to keep things like as
balanced,
regular as normal. Yeah.
Well, for me, every time I get filler, I get a big old hitch lip. And it flares up. Yeah. So I know I'm not going anywhere the next day because I'm probably going to have an allergic reaction.
Well, is that an allergic reaction or because you got stabbed multiple times in a very
maybe.
It's like swelling?
Well, they're just saying that like, I tell them all the time that can you give me something over the counter beforehand because I know what's going to happen. And that no, but they're just kind of like, no, we'll just wait and see how it goes. And I'm like, I know how
Every
it's going to
time,
go.
yeah.
Well, I mean, the next time try like taking Claritin, and if it is like an allergic reaction, that would help that. But
She
if you
sent
think
me a
about it, it's
picture,
just
and I thought she was punched in the lips.
yeah. I was gonna say
It
because
gets
it's
very
like
bad.
trauma.
Yeah.
It's like being hit in the face, but
Yeah.
by a needle many times.
Yeah, I don't know why it does that, but it does it every time. And I'm like, today's going to be different. This time it's going to be nope. And I'm like, oh, I'm embarrassed.
Second and third day swelling is usually the worst for everyone. But yeah, it's from the physical trauma, not usually an allergic reaction.
Yeah, okay, so I'll have to.
Usually the allergic reaction is insane, and those people should not be doing it anymore.
This one is always where it keeps getting bigger.
Yeah.
Is that how it's supposed to be?
I mean, it does for like second and third days are usually the worst.
Yeah, it's just like it's gonna bust. So we kept it safe, but now we're gonna get kind of into more depth of when you were working full time at a med spa, and you had to talk to these patients and tell these patients like, this is what I think you should do, blah blah blah. Did you ever feel like, I don't think you should be doing this, or this might not help? And maybe when you started your page, you felt like there were certain things that you wanted to put out there that people didn't know?
Okay, so I would never recommend something that they didn't need, but there were things that I love telling the story because I'm still like, I can't believe that this happened. So this woman, I mean, she came all the time for all sorts of things. And she was really wanting to talk about doing some lasers and like a lift. And so we talked that through. She was like ready to sign up for that. She was good. And so she was coming in for her pre-op, I think like a month later. And she calls like a few days before. She's like, I want to cancel. Like I was just told or read something about Jennifer Aniston. She's been doing honey and yogurt facials. She's like, the yogurt, like it stimulates collagen. The honey, like it lightens dark spots, like all those things. Like, I'm going to try that first. And I couldn't say, you're just going to have a really like nice smelling face. Like your face is going to smell really nice.
Yeah.
Like that's it. I couldn't say anything like snarky. I was like, okay, well, we'll be here,
Phone number will still be the same.
She came like 2 months later. She's like, I'm ready. And I was like, yeah. And Jennifer Aniston definitely had a facelift.
Yeah.
There you go.
Yeah.
Allegedly.
Exactly. And we were going to talk about that too, I think, is some things that we've been told to do this, to do that, but we also know that there are all natural things that we can do. Where's the line, or how do we determine when we should use all natural and maybe when it's like, I mean, I guess it depends on the person, obviously, but all natural remedies obviously are not going to change where you're at in life and where your skin's at. If you now have saggy jaws or
Right.
or,
So the thing is that
Jowls.
I don't know.
Jaws.
Jails. These things aren't mutually exclusive, and it's the same. Like even with if you get a facelift, you should be doing your sunscreen, your moisturizer, hopefully lasers, maybe some filler. It all works together, and not one of those things can do what the other thing does. Mm-hmm. So like there are like all natural things that help in certain ways, but it's not going to be like, okay, I need a facelift, so I'm going to, take this supplement and I'm going to work out and I'm going to put honey on my face and it's going to do the same thing. It's not like that. You want to be working out. You want to be taking your supplements, your sunscreen, your retinol, and then depending on what your needs are or what you want to change or improve, then that's when you do procedures. I mean,
yeah. And you still have to keep taking your 20 different serums, creams.
Yes.
Yeah. I mean,
I hear that the face exercises help.
Oh no.
I don't know about that, but
It exercise what?
yeah, you do like facial exercises to do like to
I do
bring
believe
down
that
your-
because, but I think it also has to do with your weight as well.
Well, yeah.
Because I mean, you see when people go through transformations of working out and their
Yeah.
face contour and things
I know when I
change
lose
like
weight,
that.
my face is
yeah.
the first thing that goes down.
Well, losing weight in your face is like one thing, but face exercises aren't going to make your face lose
I know.
weight.
Oh,
It's
that's
all
what I
over
say.
body. It's all over body
I
weight
know.
loss. And then there's some things that are very genetically coded, like a lot of people's like chin fat.
Mm-hmm.
They'll be so skinny and still have that. And it's usually like even how like their jaw is like built. So there's no exercise, even weight loss. Like if they're very small and they still have it, they have it.
What's your one go-to like face treatment?
What everyone should always do?
Yeah.
Sunscreen.
Well, besides the sunscreen, like I'm saying, like in office, like if I were to go, I've never done anything. What would be your go-to to recommend?
So it should never be like that because everyone has very different skin and what they need.
Well, I have like oily skin.
I think really great introduction if you want to see like really great results. A peel, like the VI peel, love. It's pretty intense. You'll flake off, but amazing. If you want to just look like you're glowing, but more than like a facial, like, facial is more like spa-like. The hydrofacial, it really does like pull like gunk out of your face. And you're glowy. Yeah. But other than that, it's not going to like get rid of fine lines. It's not going to change discoloration
maybe a
like
little
that.
microdermabrasion on sometimes will help a little. I've had all of them. The only thing I haven't had is laser. So I was going to ask you, what lasers do you recommend? That you've probably seen a bunch of them, and do you feel like is your top go-to for fine lines, pores, deep pores, things like that?
So fractional or Fraxel, that one is like pretty much any skin tone can do, and it helps with that really, really, really well.
So what does that do? Like what kind of laser is that?
So it basically causes very organized trauma into a certain layer of your tissue, which then causes your body to, first of all, produce more collagen, thicken the skin a little bit, which is more like younger people have thicker skin than older. It helps. So
you'll peel like after you get
most people don't really peel. I peel like the ones that do discoloration. Like if you have brown spots, those usually are the ones that flake off. But then, CO2 is like a beast of a laser. These are the things like you're not okay for like a week. Like you're not going to work. You're red and whatever. Yeah. Gold standard though, like talk about coming out on the other side.
It's like a burn.
Yeah.
Yes.
How much do these treatments cost? Like what's the price range? Well, I know you don't want to talk about prices,
I
but
don't care to talk about prices.
I would want to know.
So if you're a celebrity, apparently it's free, which is so unfair to the rest of us because they can afford it.
Somebody sponsor us.
Right. But so like something like a hydrofacial, you're looking at $150, $200. But if you go CO2, it could be $2,500. So there's a huge range. I would say
if you would like us to come
to
film laser at your office, call us.
I'm okay with not going anywhere for a week.
But yeah, like I would say that $500 to $800 range. Usually you do like a set of like 2 to 6, not CO2. Like Fraxel, maybe you do a set of 3 like once a month for 3 months. And then you're kind of good for like maybe once a year, once every few years after that. But if you have like really bad like acne scars, like really deep, and you might need to do 6 and then maybe do 1 or 2 a year after that until you get to where you want to be. So
any bad reactions to the laser that you've seen?
Yeah. So for example, if you are too dark of a skin tone and you do IPL, you're going to have an awful burn that's going to make worse. Yeah, worse. And so it is very important to go to someone experienced and who really knows what they're doing. You're not really going to have like, I've never heard of anyone having like an allergic reaction to a laser, but
I did. No, I'm not.
Like I did actually.
Again, no. Girl, just sit down.
So we saw somebody, a celebrity, from the Real Housewives, Tamra. I don't know if you saw her. Yeah. How her face was like. What did she do?
So she did a facelift, but she also did the laser. And so a lot of times they'll do it together.
I was going to say they're doing that now, right?
Yeah, which is, I think, great because if you're going to have that downtime anyway.
You have to go under to do it, or you could do it for the laser, not the lift.
No, you don't have to. You don't go under, but because she did the facelift.
Yeah, she just did it together.
But when people are like, oh my God, she's so swollen and red, that was the laser. Like she did a beast of a laser. I mean, she was swollen obviously because of the facelift too. But she looked a little bit more worse for the wear than other people who've just had a facelift.
And then she got it probably for free, so had to record herself.
Well, I don't know. She probably didn't get it for free, like a whole facelift and maybe the laser add-on or like things like that.
Yeah.
Well, I think for some of that stuff, you see, like for her putting it on TV like that, which would scare somebody tremendously to be like, whatever she got, I don't want it.
Yeah.
Until maybe you see her after and she's
Which
been
she
healed.
did look good afterwards. Yeah.
Yeah. I think that process is so important to show, though, because people, they are a lot less scared when they know what to expect.
Yeah.
Even if it looks crazy and they're like, I know it's going to be crazy.
But the end result is that.
Yes. Yeah. Versus if they get it and then the next day they wake up and they look like that and they're like, like
I know. Nobody told me.
Yeah, you have no idea, especially because we'll even tell patients, at the pre-op, at all these different appointments, but they're so excited for like the end result that they forget. And they'll call us up on like day 2 or 3 and they're like, I'm awful. It looks awful. And they have like regret for a minute. They're like, what did I do? And I'm like, trust the process. You're going to be fine.
Especially if someone comes to visit you and they're like, oh my God.
I know. What did you do?
Well, also, like, then just don't have company.
Yeah.
I don't know. I did a lip lift. I literally went to rodeo with like my sutures still in. And like, I was with my friends and they were like, are you not like embarrassed? Like, people are going to stare at you. I'm like, I literally am never going to see them again. It'll be fine.
It's true.